Hi, this is Dr. Tieche with your Medminute. And before I get started, I want to wish everyone a happy new year. So the question this week is, what recommendations for additives to an IV for also including hydration for a patient who's had bariatric surgery and is feeling malnourished and dehydrated? So that's a really good question because we see a lot of patients who had previous bariatric surgery, whether they were a complete gastric or a gastric sleeve. So the most common problem that those patients have is malabsorption. So even that's really how they lose their weight. They're just not absorbing any of the nutrients. But it translates into some other things that are potentially a problem. Really all of our micronutrients and vitamins. The most common nutrient deficiency is thiamine, and that's also called B1. That's the one that most people have a deficiency in, and that causes them to feel very poorly. After that, follow all of the B vitamins. They just are not well absorbed. Then you start looking at other things, selenium, manganese, vitamin C, things like that. And what happens is your gut just can't absorb them because the places where you would absorb it have been bypassed. So it's not there. They go through your gut very quickly and you're not absorbing it. So what happens is you get to see real life what happens when people have nutritional deficiencies. And really, we never experienced this in the US. We used to see these things in other countries when people just weren't able to have access to fruits and vegetables, that they got all of those things. And now you get to see it really fast forward when people have had these surgeries, that they actually had these nutritional deficiencies, even though they're eating, they're just not absorbing it. So you can try taking it orally. That is one way of increasing it. But again, you run into some of that absorption. So the intravenous form just bypasses that. It goes right into the system. So you want to add all of those things. And really, when you're looking for an IV therapy, you want to have a balanced one of those nutrients. You want to have the B1, which is thiamine, in that vitamin to make sure it from 1 to 500 milligrams is going to replace that nutrient deficiency. Then start with all the B complexes of vitamin C, magnesium, and trace minerals in there that are going to replenish all of those deficiencies, saturate all the cells, and get everything working properly. Because I can tell you, when people come in, they are pale looking or gray before they get an IV, and they walk out pink and full of life because that's how low they are. People even develop little hairs on the side of their mouth. That's called chelosis from those deficiencies. Plus the hydration helps because they're not always able to do that. So that answers that question about post-bariatric surgery, the micronutrient deficiencies. And I look forward to seeing you next week on Medminute.